Our next speaker is Dr. Jagpreet Chhatwal. He is the director of the Institute for Technology Assessment at Mass General Hospital. He's also an associate professor at Harvard Medical School, core faculty for the Center for Health Decision Science at Harvard University, faculty affiliate for Harvard Data Science Initiative, and associate editor for the Value in Health journal. And I think you just had a special issue, is that? Yes. Dr. Chhatwal's research is centered in decision science, AI, and health economics. He currently leads research in multiple disease areas, including hepatitis C, early cancer detection, opioid and alcohol use disorder, and mental health. He has advised the White House, CDC, and WHO on hepatitis C elimination. He has co-authored over 120 research articles, and his work has been cited in leading media outlets, including NPR, Forbes, the Wall Street Journal, and the New York Times. So welcome, Dr. Chhatwal.
Good morning. First of all, I would like to thank the organizers for inviting me to this place. It's been exciting, and this topic is very dear to my heart. I started my PhD in AI, actually. This was 20 years back. It was not even a thing. And all those years, I never branded myself as an AI person, only as a public health scientist. Then I realized maybe I'm missing a train. So this was a good time with the launch of ChatGPT. I thought, let me get back to this. And then I'll be sharing some of the work we have done focusing on generative AI next few minutes. All right, so let me explain my conversation with ChatGPT last year. Then this, to a large extent, describes this technology. So I asked, create an image of a three-legged stool. Simple instruction. It comes back with, here's an image of simple, sturdy, three-legged stool, wooden stool. It knows what I need, kind of wooden stool with natural wood finish. I like that. It adds more flavor to what I was not even thinking. And it also asked me if I need any modifications, so I have an opportunity. So this is what I get. So everything looks nice, except there are 4 legs. I go back to that, and hey, you did not follow my instructions. I asked for a 3-legged stool. What you gave me is 4. Please create a 3-legged stool. I apologize. It's being courteous. It has the manners and for the miscommunication. So let me generate an accurate image. This is what I get. Fantastic. So this is what is happening. It does many things. It can pretend to do many things which we don't want. But it does not have that context of understanding exactly as we as humans do. So this is what the technology was last year, but it's also changing. I think somebody saw my talk, and this is what finally in 2025, it creates a 3-legged stool. So the message here is that it's powerful technology. It understands many things. It provides me more things to think about, like that wooden finish and all that things which I did not even think about. But it may sometimes miss the context of what I need. So coming back on a more serious note, we have this ISPOR working group on Gen AI. And part of that group, we published this perspective, which was more than a perspective on how we can use Gen AI for health technology assessment. I think we can broadly apply to public health, many of these findings. And we came up with these 4 things. First is, it can really assist with literature reviews. It's, I think, no doubt most people have experimented with that. I'll talk more about that. Like we can automate many things in our work. It can help with real-world evidence by automating processes and analyzing large volumes of data across different platforms, structured, unstructured. You can combine imaging with MRI, most advanced imaging with text notes very easily and come up with some conclusions, which earlier was not that easy. In health economic modeling, this is an area where I'm largely focused on. We can build models very quickly. I will not be going into this topic today for the sake of time, but it shows the power of combining the traditional methods of health economic evaluations with Gen AI. And finally, writing reports, text, which we all know is the power of large language models anyway. And we also conducted a survey last year. We are also this year within the ISPOR group, about 400 people responded. What specific areas of health economics and outcomes research do you believe Gen AI can have the most impact on? Any guesses here? 2. I'm hearing 2. Yes, indeed. Many of us have experimented, and you saw Dr. Shu's talk previously, like evidence collection, evidence synthesis. It's helping. What are the main challenges you face when implementing Gen AI in health economic evaluations, or broadly, say, let's say health policy, public health research, for the sake of this conversation? 1, 2, 1. I'm seeing several heads nodding. It is 1, data quality and reliability. So some of these are obvious, and things are also shifting as we are advancing with this technology so rapidly. We have started seeing that trends are going down, that more quality is getting better. Now we are thinking about other hurdles like regulatory hurdles, ethical considerations. All those things are going to be emerging up. Now it really matters how you ask question to Gen AI. Many of you have experimented with that. And there's a new field which is called prompt engineering. I'm an engineer. I never heard about this 3 years earlier, this term. It's a new thing which has come up. And what it really means is how you ask question, and that depending upon that, you will get an answer. So here's another example, like generate an image of a full glass of red wine. How many of you have, like, take red wine? Few hands. How many of you ever had a glass full of red wine? Couple of brave ones, 3 ones, good. But ChatGPT did not, so this is what it gives me. But I can flip the question in a way and get a response. So if I change this to say that, can you fill it to the brim? Then it understands. So this is where, like, how we interact with that is also very important. Now, it's actually a field. Since it's called engineering, there has to be more science to that. And actually, there are different ways we can do this prompting. And these like zero shot, few shot, chain of thoughts, self-consistency. I don't need to go into details, but any of people have heard about these terms, some of these, right? So the way we create prompts, actually I see many hands. Actually, last time I was giving a talk, nobody had heard about these things, so I was surprised. So an example of this is, let's pick an easy one, persona. So you ask that, you tell, okay, who you are, and then ask the question, you're a math expert, please explain to me what is pi. Well, it's a mathematical constant that represents the ratio of da-da-da. All makes sense. Now I change the persona. You are a public health expert. What would you guess will be a response, or how it will respond? Same. Any other guesses? Well, that's good. This is interesting. I'm going to pause a little more and see if there are more creative ideas that come up. Bingo. So this is what it is. Like, I was not even thinking, I was surprised. I was thinking pi in my head, but it's, yes. So the way you set the persona, it can really change the context of that. We as humans may have certain things in our mind, but we are not even thinking about it. I'm thinking, even for this experiment, I was thinking of pi as pi symbol. And let me try what as a public health. I was expecting that maybe it's going to explain with some example from public health what is pi, but I was surprised. So that's what the message here is. So you have to be very careful with this technology, which is powerful. It gives us the power to use this technology, but we have to understand some of the nuances, subtleties that come along with that. Now, coming back to the systematic literature reviews, I'm assuming many of you have done that in your career, or we have worked in the past. It's a really labor-intense, time-consuming process. It can take months, 6 months to 18 months. That's the time frame that I've seen in studies. And there are different steps people follow. It's a very structured way of, you start with the search strategy, you have title, abstract screening, bias assessment, data extraction, meta-analysis if you need, and then writing a report. Now, many of these things can be done by Gen AI, and people have been experimenting for the last 2 years with all these platforms that are becoming available. And what we have done is we looked at reviewed all the articles that were published until early this year. And we found 25 studies in published domain that have used AI for systematic reviews and documented their accuracy. So what that is, that they've used all kinds of these platforms, GPT, BERT, Gemini, Claude, and others. And it's shifting. We have seen that it's Earlier, GPT was more powerful, then in some cases, Gemini became powerful, and then Claude came, and then they all have strengths in certain areas, and they keep changing from time to time. So my conclusion is there's no one best platform that we can rely on. So what was the performance? First, what kind of things these 25 studies conducted? What in these steps of systematic reviews, like title, abstract, screening, majority, and then full text, etc. And the accuracy was, it varied. For title and abstract screening, very accurate in high 90s, which seems quite promising, and we have seen that it's good. Even if there's certain errors, it misses some articles, it's fine. It's not really a fatal flaw. We can live with that. For full text screening, we have started seeing the accuracy going down. For data extraction, it's becoming more or less like it hugely varies depending upon what you're asking it to extract. It's low as in 60s also. And for bias assessment, also pretty good. Now with that, it tells like, are we really moving the needle? Like, are we shifting things? And perhaps so. And this was the New England Journal of Medicine AI. This was in the first issue, all the editors published this editorial things and why we support. They not only support, but actually encourage the use of AI in their publications. And they say that as long as you as authors take the responsibility of everything that goes into that paper, we are fine with that. So that really changes the narrative for all other journals. And we as scientists, as we write papers, it gives us, okay, it's acceptable. If it's coming from a journal like that one, it should be okay. So that's shifting things. And also the many other agencies, guidelines they're coming out with. And NICE was one of the first ones, National Institute for Health and Care Excellence in UK was the first one to acknowledge the use of AI in evidence generation. And they said that we follow the principle of augmentation, which is the most important. It's not a replacement of human involvement. So that's the key that we should keep in mind. Now, we should understand the limitations. That's very important. Like this was earlier discussed. Dean also highlighted that we should be aware of these things. So here's an example of a limitation. Create an image of a child using their left hand to paint. How many of you are left-handed in this room? Less than 10%. So this is what I get. And I've tried many times, and it still shows me everything. It's nice. It has child painting. The water is there. The colors are there, except it's a right hand. That's the bias. That's the limitation that goes into these models. Now, if you try multiple times, I'm guessing at some point you will see a child with left hand. It's a probabilistically less than 10% times you may get that image. So this, again, the message is that we should be aware of biases that go into these models in the context of our own research that we do, how we're using these models. And to summarize, other limitations like accuracy concerns are there. As I mentioned, human oversight is critical. Potential for bias, reproducibility. That's another big one. Like if I do something, you do another one, it may not give you exactly the same answer. But how do you define reproducibility? It may change a little bit, but are we okay with that definition now? And the explainability is also can be a concern in general, which is the case for any AI models. So just to summarize, key takeaways, there's no doubt this Gen AI technology is transformative. But where we are today, it's essential that human oversight is critically involved there. We cannot overlook that step. We should also be aware of the limitations of AI, or Gen AI in particular. And whether you like it or not, it's going to stay here. And the last one, it's many of you may be wondering, will AI take my job? Or you may have come across this question. This was from the Harvard Business Review. It won't, but people who use AI will. Thank you for your attention.